Let me quickly introduce our speaker then, Reshma Kakkar from the Association of Public Health Laboratories in the US. Reshma is an informatics manager for APHL's global team with lots of experience in laboratory informatics development, where her specialties include planning and implementation large-scale global health informatic projects to support APHL's direction in the digital health solutions. She will be joined by her colleagues. She will be joined by Dr. Sofia from INS, Instituto de Nacional de Saude. Let me quickly ask Reshma to share a presentation and start whilst I'm sorting my connection here.
Okay, so I'd like to start by saying greetings to everybody. As Anafi introduced us, my name is Reshma Kakkar, and I work with the Association of Public Health Laboratories, or APHL, along with my co-presenter, Rufus Nyaga and Sofia Viegas. We thank ASLM for the opportunity to share with you more.
How do I hear this Zoom? It's kind of loud. Deco. Deco. Okay, small. Yeah. This is the increase volume.
All right, let me continue. We thank you for the opportunity to share more about laboratory data management options for COVID-19 and immediately notifiable diseases. As you will see from our title, our goal is to share solutions that can build capacity even beyond COVID-19. So with that, I'll do a brief introduction on who APHL is. We are a US organization with a global perspective. We are a member organization and we support government sector laboratories that conduct testing of public health significance. We take the expertise and competencies that we have domestically and support international institutions all around the world and have had the honor of working in over 55 countries over quite an extended period of time. So for today, our learning objectives are to describe the strategies used to support data management needs of laboratories for COVID-19 testing. We'll start by spending about 15 minutes laying a foundation around the data management practices and strategies we have used. Then we will hear from my colleagues in Kenya and Mozambique about their experiences applying these strategies and what lessons they have for us. And we will wrap up with suggestions for moving forward. So to start, we decided to list out some of the challenges that probably look quite familiar to many of you with managing laboratory data and specimens. And these are turnaround time, data quality, reporting, and data sharing. And we'll see how we have worked to provide some solutions for these. Some of the strategies that we have developed are, and there are 4 primary strategies we will be covering today. LIMS expansion, and LIMS is Lab Information Management System, enhancing that add COVID-19 testing and reporting, a centralized laboratory data repository, data exchange, which includes linking lab analyzers used for COVID-19 testing with the LIMS, as well as exchange of data between different systems. And 4th, electronic sample referral, which is capture of lab data electronically at points of sample collection, submitting to the LIMS at the testing laboratory, and return of results similarly. And I'd like to start by saying that we have taken a system agnostic approach, so we are not promoting any particular product or solution. This is more of a holistic view as to how some of these solutions can be provided. So we'll start with number 1, which is the LIMS, or the Lab Information Management System. And we wanted to give you a guidebook that we have developed recently, because in our experience, we have found that a lot of projects to support these information systems can be adversely affected or even fail sometimes due to poorly defined requirements or the application not being appropriately selected. Involvement of stakeholders. So over the years, we have learned the importance of well-planned and appropriately implemented laboratory information management systems, or LIMS. With this experience, we have created this guide to share best practices that have been developed over a few decades of working with different country governments, the challenges and lessons learned, and the solutions we have developed. So please feel free to reach out and access this guidebook that is available through that, the link on the slide. So we now dive into what is aLIMS. aLIMS is a computer-based information management system created specifically for laboratories. And there are two main parts that we are covering here, that it supports workflows and it supports reporting. It supports workflows through tracking of data from the start to the end of the testing process. It also helps to store laboratory data and to get data out and provide correct and complete information to laboratory staff, managers, customers in a timely manner, allowing for decision-making by clinicians, epidemiologists, and stakeholders. Why are we talking about LIMS so much? Why do we hear about it so much? In the last decade, there have been several technological advances in lab instrumentation, and that has led to high specimen volumes and a great demand and reliance on laboratory data, as we have seen during the current pandemic. These advances have demonstrated that paper-based record keeping and results reporting are very challenging to support the lab's business needs. As a result, there has been a tremendous growth in the demand for LIMS at all levels. And this increased demand on LIMS has allowed end users to also be more articulate of what they expect from the system. And that in turn has led vendors to develop more attractive, viable LIMS options. So a very high overview of what the role of a LIMS is to decrease the transcription errors that we often see occurring from manual writing of requests of results, meeting quality standards, helping to reduce overall turnaround time, and improving patient outcomes in public health. All of these we know are very, very critical during our current pandemic. Some of the core functions of a LIMS is to remember that the LIMS actually impacts all three phases of a specimen life cycle, from pre-analytical, analytical to post-analytical. In the pre-analytical phase, from reducing the login time, identifying the specimen correctly, identifying any issues with labeling of specimens. In the analytical phase, from correct specimen test identification, reducing transcription errors from instrument data capture, validation of results, and in post-analytical to help create reports for diagnostic and epidemiological purposes, for effective EQA programs, etc. This systematic collection of data greatly improves data security, facilitates better data validation, and prevents damage or loss to data. It's very important to remember here that a LIMS does not simply automate a manual process that may be problematic to begin with. The LIMS can actually help redesign the process and then automate it. To be impactful, the data from a LIMS needs to get into the right hands quickly. It must be provided to multiple stakeholders across clinical and public health. It must be accurate and consistent, and all solutions that we work on have to evolve to meet the new data sharing needs of lab and surveillance. All of these, again, being very critical for us right now. So that was strategy 1. We now go to strategy 2, which is a centralized lab data repository. And this is a diagram of what the repository can look like. It provides a single storage location for countrywide electronic data regarding laboratory requests and results. This allows lab managers and other stakeholders to easily view relevant data on the entire country, different geographic levels, or data down to the lab and the laboratory section. Point of care instruments can also send data to the repository, as you can see in the diagram, as well as mobile laboratory systems. And collecting and centralizing as much data as possible allows stakeholders to monitor a variety of issues related to laboratory data. And we will hear more on this from my colleagues from Kenya and Mozambique. So we now move on to strategy 3, which is data exchange. And under data exchange, we cover instrument interfacing as well as system integration. Start with instrument interfacing. That includes the capture of test results from PCR analyzers, sharing of these data both with the LIMS as well as with the central repository, and then capture of test results from point of care rapid diagnostic instruments and sharing of those data with the repository. And we have a diagram to show you what that can look like. I know this looks a little complex, and I'm sure these slides can be shared with you, but the middle section is the part that we're talking about in terms of when the sample is received and logged into the LIMS, into the computer in the middle, and then the order can actually be sent to the analyzer and the results transferred back to the LIMS client. The second part of the data exchange was the integration with external systems. Again, this is a very brief overview of the different types of exchange that can take place, including the linkages with systems such as surveillance systems or dashboards to enable us to make full use of the LIMS and get the greatest value out of it. And again, you will hear more about this later on. Strategy number 4 is electronic sample referral. The goal of electronic sample referral is to enable patient data and test request information to be sent from a health facility to a LIMS in a designated laboratory. And what this does is it reduces the burden of data entry within the testing laboratory, enabling the laboratory staff to focus on testing and making that the priority and not taking up too much time with data entry. And the second part of the electronic sample referral is enabling results from the LIMS in the testing laboratory to be returned electronically to health facilities. Again, reducing turnaround time, reducing transcription errors, as we had mentioned earlier. So again, a quick overview of what this sample referral and testing can look like for COVID-19. On the left are the health facilities that are referring electronic sample data, which are the red arrows, to the laboratory that's doing PCR testing and has a LIMS installed. Once the testing is complete, the results go back through the same mechanism, which are the green arrows, through that sample referral system back to the health facilities. And meanwhile, the lab can also share data with the central data repository, and those data can then be pushed out to either dashboards or other external systems. So some quick lessons that we have learned from electronic sample referrals. The do's are on the left, which is that data elements must be defined. What are the key data elements that must be collected? Building of data quality checks, making sure that there's agreement on specimen identifiers, use of health facility codes. This has become extremely helpful as more and more sites are referring samples, and then having some way to resolve issues as they come up through a help desk. What we are suggesting to avoid, or we have learned along the way, is to not build standalone systems. The systems do need to be able to talk to each other. And as these sample referral systems grow, it's very important to have some kind of a plan and designated sites that those referral systems get expanded to. So with that, I would now like to start on our country experiences and hand over to my colleague in Kenya, Rufus Nyaga. Rufus?
Thank you, Reshma. My name is Rufus Nyaga, work with APHL in Kenya as it's been introduced. So I will just share the Kenya experience of what we've been able to do in response to COVID in supporting the Ministry of Health in the response. Next slide, please. Okay, so this is an overview architecture of how we are managing the COVID data in Kenya at the moment. We have a total of 32 different laboratories that are testing for COVID across the country. They are all been given the go-ahead by the Ministry of Health. For this, the labs listed in the middle of this diagram are the laboratories that the testing COVID PCR COVID testing laboratories that receive sample requests from the surveillance team. So the surveillance teams will send the requests to the testing lab, who will in turn test and then return the results to the surveillance team or the facilities are asked for the samples to be tested. And then the different testing labs are actually required to send that data to the central repository, as Reshma was explaining earlier. So the national repository in Kenya has been put up at the National Public Health Laboratories. We basically extended the lab information system that was used, that is being used at the National Public Health Laboratories, and that is able to hold data from all the testing labs. So at the moment we are seeing a total of 32 laboratories testing, sending data to the repository. And then at the repository level, we have the data team that work on the summaries and then advise the Ministry of Health that are able to do the daily briefing, updating the country of how the pandemic is unfolding in the country. But at the same time, at the repository level, we've been able to integrate with the external system. At the moment, we've integrated with the Jitenge. That's it's a follow-up application in Kenya. And then we are already doing some work to ensure that we integrate with Kenya EMR. I think before the end of next week, this one should also be done so that the results are able to be fetched from the repository to the Kenya EMR system. That is an open MRS. And then this data can be used to feed into the dashboard and all that. So the integration with from the repository now, it's on case basis. And we've already started discussion on how we can push some of that information to DHIS too. In doing that, we've worked with many partners, and I'm happy to see most of them here, for us to be able to get the data from the 32 testing laboratories. Some of them are using an application programming interface API, or a standard data collection tool that have been developed on the National Public Health Laboratory portal, where the facilities actually just log in and upload the data to the national repository for COVID. Therefore, I can say, like in Kenya, all the data that is reported is aggregated in one repository. Next slide, please. So for us to do that, this is the simple process that we had. Unfortunately, during the pandemic, we didn't have a lot of time really to like do it to do it at book. But some of these things we did them and then corrected as moving forward. But our greatest idea has been, it's always good to standardize a process before we start automating it. As Reshma has said in her previous slides, it's good to automate the process. Like, for example, if you're looking at having data collected from various facilities, it's good to standardize how that data is being collected so that it's easy for you to have the same data being pushed from the different labs that are from the candidate laboratories that are supposed to send data. So in our case, we standardized the data collection. So initially all labs were reporting using different tools, but we standardized that. So we standardized the data collection, and then we started the automation, automating process. So during the automation, we talked to our partners, like the Chai team, who are supporting like 11 automated labs. So to be able to automate their process so that it can match our repository. And then at the repository, we did the aggregation, the analyzing, and then we share data. So if we go through this process, we realize at the point of sharing data, it's very easy because we have data that is comparable. Next slide, please. So these are the tools that we used to standardize the process. So we had a standardized Excel form that standardized the way data was being collected at the various testing labs. And then we designed an API with the National Public Health team that allowed facilities that are using lab information system and they wanted to push data automatically to the repository to be able to talk to that API and data could be exchanged. Next. Next, please. Okay, so these are just a few screenshots from the system after we configured it at the National Public Health Lab to support the COVID testing. There's nothing much, just want to show you how it feels like. Next slide, please. So these are some of the outputs from the system. The reports, the patient reports are generated from the system, and then the worksheets to make the testing easy at the testing lab, at the various testing lab. So at the National Lab, we have 2 labs that we've supported the lab information management system. That is the National HIV lab as well as the NIC lab, but also some other facilities across the country that are using the similar platform. Next. So what are the key lessons that we learned from this collaboration with the Ministry of Health and other partners in Kenya? Collaboration works, and then it's important for us just to come together as different players in the same field, and then we look at the systems that are available, and then we work together just to make sure that the systems are able to talk to each other. So ensuring that the systems are integrated is key, because we have many systems, and as many systems as they are all serving the same population. Therefore, it's important to make sure that the data can be shared easily. And then capacity building, making sure that the Ministry of Health are leading the team so that when the partners leave, then the ministry can take over the system and they can be able to move forward with it. And finally, think from a user. As we are developing these systems, it's good to think from a user point of view. Make the solution so simple, because lab people are specialists, they are scientists, or they are highly professional people. And if you have a solution that is not so simple, then sometimes you find that the users start saying the system is not working for them or it's so difficult. So work from their perspective, make it simple, and then they'll be able to adapt it and go forward with it. I think that is all from the Kenya. I want to pass it over to my next colleague. Thank you.
Thank you, Rufus. Sofia, over to you, please.
Thank you, Reshma. So good afternoon, everyone. As Anafi have introduced me already, but let me just reintroduce myself. So my name is Sofia Viegas, and I'm the Public Health Director for Laboratories in the National Institute of Health, which is the Public Health Institute in Mozambique. And I will share a little bit of our experience in implementing laboratory information systems to support the COVID response. So next slide, Reshma, please. So we've been working with APHL for many years in the laboratory field, but recently mainly on implementing laboratory information systems. And for COVID, we made use of the existing system that was created to support viral load testing. And as you can see in the figures, it was shown already by Reshma and Rufus, but in summary, so the samples, they are collected in the health facilities, and then they are transported to a specific hub. In the hub, there is a laboratory system that allows the registration of the samples to be referred to the testing lab. That hub also allows the reception of the results as soon as they are ready in the lab. So the system was created, as I mentioned, for viral load, but now also supports the early infant diagnosis of HIV testing, beside, of course, COVID now. So we made use of the existing system to establish our COVID network and our COVID links. Thank you. So in general, our solution, as I mentioned, made use of an existing system. Before this, we were using paper-based. There were very few samples for COVID in the beginning, but in a very short time, we managed to introduce the COVID testing in the existing LIMS. And we did that very quickly. I think it was maybe 1 week. And because it was the only way to manage such a big volume of samples that we were receiving. So one thing that it's important is that the samples, they are barcoded in the hub. So from the hub to the testing lab, we can track the sample. We know if the sample was lost in the transportation chain, if something happened. So it's important that they are barcoded in the hub and we can track them. So we don't have samples that are lost. Or if they are lost, at least we know that they were lost. Another thing that Reshma also mentioned is the interface. Because we were introducing manually the PCR results from COVID, and when you receive so many samples, when it comes to hundreds or thousands of samples, then an interface really helps the lab staff. So you really need only to verify, check if everything is in, if the results are in order, and then validate. So it really makes the lab staff life really much easier. And that, of course, have improved our workflow, even within the lab, from the reception to the validation from the reception to the validation of the results. So we do have a data repository where all the information from the different labs. Now we have a total of 6 labs testing for COVID in the country, 6 public labs. But we are at present we are using the laboratory information system only for the public labs, and 3 of them are using open PCR platforms. 1 is using the Abbott platform, and 2 are using the GeneXpert platform. But all of those labs, the data from all those labs is centralized in the data repository, which allow us to extract the information from the data repository and have it ready for the press conferences and bulletins that we have to do it daily to communicate, to inform the public and the government about the country situation. And also helps the data management and analysis in a daily basis. So it really helped us a lot. In terms of simple referral, as I mentioned, in the hub, so they can they make the registration of the sample, but as soon as the sample is ready in the lab, they have the results. So as soon as the lab staff, they validate the results, the result is in real time available in the hub. So it really reduces the turnaround time, and people can have access to real time result reporting. Next slide, Reshma, please. So in terms of reporting, we have different types of reports. We do have email alerts. One type of email is sent to the central level, which combines data from all over the country. Another type of reports is daily sent to the provincial level, where we have selected only the information from that particular province, and that is shared with the province. And we can also have, and we are already sending for some health facilities. Health facilities can also receive their own reports, and even at district level. We are now about to start a pilot sharing the results via email in Excel format for district level as well, so they can quickly make actions. As I mentioned, patient results are sent to the hub immediately, so they don't wait for the daily report. As soon as the result is ready, they also have access to the report. So I also wanted to share with you the format of the reports that we receive. Reshma, can you please click on the Excel report? Yes, this is the type. It's in Portuguese, but I think it's fairly easy to understand. So we have the different provinces, the number of samples that were registered, that were validated, the number of pending samples. We have the turnaround time, even the turnaround time for the different labs. And we also have the reason for testing. So the table that you have below is the reason for testing. If it is for screening, if it is for how do you say, to confirm if the patient is cured. So we do 2 PCRs. So the type of testing, why they are requesting. So if you click the next sheet, Reshma. So in the same report that we receive daily, we also have, so we have one sheet that is aggregated data, and then we have another sheet that it's individualized data. So we also have data per patient. So, and since we are really much familiarized with Excel, so we quickly can manipulate the Excel sheet, and we can filter the positive ones. and we have defined that the positives are shown in red, so we can quickly make action, and this is easier to analyze. And so we have one sheet of analyzed samples, and then we have one sheet of pending results. So this also helps the lab to make sure that that the samples are sent within the turnaround time, and if you are out of the turnaround time, you can quickly make actions, inform, etc. So this is the type of report that we receive, and we find that it is very useful. Reshma, can we go back to the slides, please? Next slide. And this is the type of dashboard. This is the type of dashboard that we are developing. So we can in real time see the number of samples that were tested, number of positives, and so on. But we are still working on the dashboard. As I mentioned, for example, the information from the private sector is analyzed, still being analyzed manually. So they share an Excel sheet, and then we have to introduce. So we are working on a way to improve the capture of data from the private sector. Next slide, please. So I listed some advantages of the system that we are using, and that we feel like it's helping us to improve the data management of COVID samples. So as I mentioned, results are available in real time for action in the testing in the hub. There was a reduction of turnaround time because of that. Because the provinces, they do the registration of their own samples, they can manage that. They can have their own database on the hub. And we were wasting so much time on doing the registration of each sample. So now that there's several hubs, they do the registration by their own, so it doesn't, our staff is not that, is less busy doing the registration. And daily reports allow provincial authorities to follow provincial data. So the type of Excel file that I showed is also shared to provincial, for each province. So they can follow up their data. And based on that, we also prepared the information for the press conferences, for daily bulletin and other type of reports. That type of reports also help us to monitor the turnaround time, and also allows continuous improvement. We usually, we always have something that we want to improve, some additional indicator that we want to include. But we also have challenges. Internet connection is probably our main challenge, because not all sites, they have internet using cable, so they use mobile modems. And sometimes the internet from the modem is used for other reasons, for personal reasons. So sometimes the modems are removed from the lab because they are mobile. So we have, and without internet, we cannot connect the different labs, the information from the different labs in the data repository. And the registration, we we have too much data to enter in the system, and sometimes people they are not that quick to enter the data, so it can be slow sometimes, and we waste a lot of time in the registration in some sites, and we have missing data in many sites as well. Regarding the interface, every time we have to change the type of reagents we are using, we need to set up the interface, and that is also a challenge. And that there is a need to have IT staff dedicated in this type of process. So this is our feeling of the main challenges in implementing the system. Thank you.
Thank you, Sofia. So we are now going to move on to what we're calling next steps. This does look like a complicated diagram, but we are making this diagram part of our COVID-19 lab data management guide that we will be putting out very shortly. And these are options we are presenting based on work APHL has done in multiple countries, as well as our knowledge of infrastructure resources. So this is a decision tree to help figure out what path of data management is most appropriate for your particular environment. We're also highly recommending, as you have heard through the different experiences shared, what we would call a consistent lab data management strategy, which is crucial for managing COVID-19 testing data, as well as data for other priority diseases. We're suggesting two broad actions. One is a working group co-chaired by both EPI and Lab, and this might already exist in several of your countries, but to make some of these decisions around key lab data elements, how to improve workflow, who has access to data, what data sharing agreements need to be developed and put in place, etc., as we have listed. And then also the National Lab to develop plans for what data systems currently exist, what specimen collection sites exist, what is the plan for expansion, if there is specimen referral, etc. And in addition to these, we recommend considering the following questions. What data are being collected? How are the data defined? How are the data stored? And then who needs those data? Are they individual results? Are they aggregate results? How will they be shared? How will they be retrieved, etc.? And what's the purpose of generating all this data if we don't have some emphasis on data utilization? So we are strongly suggesting that ministries of health and stakeholders really try to use these data for informing their policy and updating strategies and response measures, not just for COVID, but for also other notifiable diseases. As we have discussed, information systems, whether it's LIMS or the repositories or sample referral systems, can greatly increase the capabilities and capacities of both diagnostic and public health laboratories. We all know that funding for laboratories especially can wax and wane. Therefore, we're recommending that an important step is to lay a common foundation that you can build upon regardless of disease. Use some of the strategies we have listed here, reference the guidebook to look at some of best practices that you can apply for lab data management, and think about it as an overall ecosystem for supporting your overall lab data management needs. With that, I would like to say thank you and acknowledge the National Public Health Laboratory Kenya, INS Mozambique, as well as CDC. I hand over back to you, Anafi.
Thank you very much, Reshma Rufus and Sofia for the wonderful presentation. I'm having a bit of a challenge in the internet connection, hence I hope you can hear me. I have tried to connect with a different device, hence the sound is coming from elsewhere. So we now get to a stage where we are taking questions. Should I disappear, I think my colleagues will be ready to take over. The first question came from, I think it came privately. We encourage you to send the questions to everyone. From Godfrey, who has directed his question to Rufus regarding what's your definition of a system? You kept on referring to a system. What exactly is a system in your reference? Thank you.
Thank you. This is Reshma. I can start, and then if my colleagues would like to chime in. I think that's an excellent question because we do use the word system a little bit loosely. We presented 4 strategies, and I would call that an ecosystem for lab data management. Under those 4 strategies, we talked about a laboratory information management system, which is an information system that resides within a laboratory to manage all the processes within that particular facility, from analytical, from pre-analytical, analytical, as well as post-analytical. The second strategy was a central data repository that could reside at the national laboratory within a country, at the Ministry of Health, to receive laboratory data from all over the country to give the ministry, help the ministry be as informed as possible about testing within the country, about workloads, about testing capacity, etc. So that's part 2. Part 3 is equipment interfacing, which is enabling capture of laboratory result data, but also sharing. I think we call it data exchange. So sharing of those laboratory information systems with other systems. So let's say you have an electronic medical record system that's being used in a hospital or a clinic, how to engage that medical record system with the lab information system, because a lot of the clinicians rely on laboratory results for decision making. So integrating those systems. And then the 4th was the sample referral system. So again, using technology and using capacity to capture data on specimens even before they arrive in the laboratory, getting the data to the testing laboratory so they can even be better prepared for the samples that will arrive. When the samples reach them, they acknowledge that the sample has been received. Minimal data entry required in the testing lab, giving them the ability to focus on their actual testing processes. So I would say in a way that's the entire ecosystem that we are sharing today, but you can also break them down into individual pieces. But Rufus or Sofia, anything to add?
No, thank you, Reshma. I think you've covered it well.
Thank you, Rufus and Reshma. The next question is from Robert. Robert says, what LIMS systems or database systems are you using in Kenya? Is it compatible with DHIS2? Or how do you support interconnectivity for smooth flow of information from testing points to, I think you wanted to say, to the central point?
Oh, okay, thank you. As we had shown on the presentation, so we have 2 approaches of sending data. So number 1 is through an API. So if the laboratories, the testing labs are using automated system, they could use an API and push data to the central repository. And number 2, there is a use of the National Public Health portal where you can basically just log in and upload a standardized Excel that you'll have populated and upload the data to the same repository. So those are the 2 options currently we're using in Kenya. And then finally, the system that you're using. At the National Public Health Laboratories have been using Labware as a lab information management system for 10 years now. So that's just the same platform that we expanded. One of the strategies there, as shared by Reshma, we expanded that lab information management system to be able to capture the data for COVID. And yes, it's compatible with DHIS, and we've tried that, and we can be able to integrate with DHIS. Thank you.
Thank you, Rufus, for that. I'll take the next question. And this is also from, yeah, there is a question on costs. What are the costs associated with maintaining LIMS by a laboratory? Hello?
Reshma, do you want to take that? Okay.
Or what are the key elements that could be in the costing? Yeah, thank you.
Okay, so I think majorly the biggest cost when it comes to maintenance of the lab information management system is the human aspect of maintenance. That is the IT team that you need to be able to support the lab information management system. So lab information management systems, as much as it's being used in the lab, it's an IT solution. Therefore, as countries are planning to have lab information management system, I think it's important for them to think about the maintenance, and more especially having a person of their own, a ministry person who's able to manage and to be able to help the users of the system. And in this case, we're talking about the lab people to be able to use the system going forward. So in the budgeting aspect, you need to make sure you budget for an IT person, but at the same time, think about other things, your backup solution, your infrastructure. How old is the server that you're using? Do you have a plan to replace it when it's lived for so long? So you need to have a budget for the normal maintenance of LIMS. And obviously the other aspect of antivirus, the security aspect, the internet. So all those things need to be put together in a budget that supports the maintenance of a lab information management system. I think I've partly answered the question. Thank you.
Thank you. I know time is not on our side, but I'll take one more question, which sort of was recurring, and it's about confidentiality. Philip and Ayetenu and someone else as well. How do you ensure data confidentiality, or how is data confidentiality controlled? What are the levels?
Okay, so in terms of data confidentiality, I think that is paramount. Any lab information management system needs to have that in mind, because essentially you're handling a lot of confidential data on the users. Therefore, I think control of the system, access control of the system comes as key. Who is able to access the system? So just the normal thing that we know of, just making sure that you have a clearly segmented lab information management system, and everyone who have access to the lab information management system can only be able to see what he is authorized to see. For example, if someone is not working in the HIV lab or in the COVID lab at the moment, he is not supposed to see the COVID data as per se. If he's working in the TB lab, he's not supposed to be seeing the COVID data. So just making sure that the system is correctly auditable, so we have a live audit trail that you can be able to trace who accesses what at what time. And then number two, just making sure that only authorized people are having access to the system. And then especially when it comes to data sharing, you agree on what aspects needs to be shared. And if you're sharing personal identifier and personal data that can identify a patient, you just make sure that you put in measures such that you're doing the data sharing in a controlled environment that is secure and cannot be infiltrated by other systems. So just making sure that the security aspects are thought through at the design stage is critical just to make sure that the lab information management is secure. Thank you.
Thank you a lot, Rufus. We are right at the top of the hour, and we acknowledge a lot of questions that are in the chat box. What we will do is to get hold of our presenters to help us respond to these questions, and we share alongside the presentation slides, as well as the session recording. Just to thank, I think, the presenters on behalf of ASLM, as well as all of you who have attended for this wonderful session that we have had today. Indeed, it's critical for us to continue using existing infrastructure, particularly for management of data, which is going to be informing us to make informed decisions. Not many announcements today, but we are still waiting for countries, particularly on the LabCorp side, to send us nominations for the sub-community of practice. Among the three of you, Rufus, Reshma, and Dr. Sofia, just a few seconds, words of closing remarks.
May I?
Reshma? Yeah.
I'm not sure if Reshma is still online. Yes.
Yeah, please go ahead, Dr. Sofia.
Thank you, thank you. So a key message would be that really the LIMS should serve the country purposes. So the way we need to design is really to respond the country needs, not also in terms of registration, data security, confidentiality, but also to provide in a timely manner the daily information that the country needs, in particularly now that we are facing this pandemic. So we really have to make sure that we don't just have a LIMS, but we have a LIMS that serves the country purposes. And fairly easy, I think my colleague also mentioned that should be easy to use. Easy to use, easy to interpret, and to respond to our needs. So the government and the state needs. Thank you.
Thank you very much for that wonderful presentation. And what's left for me is to just say thank you to everyone for coming through for this wonderful session. Until we meet again. Bye-bye.